My name is Alina S.P. Galarzo. Today is June 3rd, 2020. I'm going to be doing my recording with a share screen because I couldn't print it out for some reason, but I have everything up here, and then I'll just be putting up here as well as on my own body. Also, here is the paper with the bones that I have written out. Okay, so I'm going to start by pulling out the main components of the body, so your cranial, and then the axial part of the body, which is more like your chest and your pelvis, and then the the appendicular, so your arms and your legs. And so in the cranial, we have mostly flat bones, and that's going to be like your nasal, maxilla, mandible. We have the frontal, parietal, temporal, occipital, and zygomatic. And then you come down to your clavicle, which is known as a long bone, as well as your humerus and your femur. So these are all long bones, these here. And then you have your ribs. So your ribs 1 through 7, those are usually known, those are known as your true ribs. And then 8 through 10, those are your false ribs. And your last 2 ribs that are more in the back right here, those are your floating ribs. Your vertebrae, that's known as irregular bone. So that one is because it curves on your back. And then you have your cervical, which has 7 bones. Thoracic has 12, and then lumbar has 5, which goes down to your coccyx and your sacrum. Those are just smaller bones in the bottom of your pelvis, which is also right here. You have your pelvis. And then on your arm, and so how I remember those bones, or like how many bones are in each, is just remember like cervical, you have breakfast at 7 a.m. And then your thoracic, you have lunch at 12 p.m. And then lumbar, you have dinner at 5 p.m. So that's how I remember how many bones are in each one. And then you also have your humerus, which is connected by your ulceron, which is your elbow. And then you have your radius, which is the bone that's more closer to your thumb. And then your ulna, the smaller bone that's closer to your pinky. And then after that, you have your carpals, which are your short bones, as well as your tarsals on your feet. We scroll up here, these are your tarsals. And then connected to those, you have metatarsals. And then connected to those are your phalanges. And that's on both sides of your body. And then if you scroll down, you have the biggest bone in your body, which is your femur. And I already said that's one of your long bones. And connected to that is your patella, which is your knee. This bone is considered to be a sesamoid bone. So that's your knee right there. Then you have your tibia. This is this long bone down here, also like right in front of your shin. And behind that, it's a smaller bone. It's not showing right here, but that's your fibia. Usually it would be right here. It's more like located behind your tibia, like your ulna and your radius. And then down here, you have your tarsals. And I've already said up here how these are also your short bones. They're similar to your wrist bones. And connected to those are your metatarsals and your phalanges, which are similar to your hands and feet. So some of the ways that these bones, like your skeletal system, is really important. The field that I'm going into is occupational therapy. And so we do a lot of like making people whole and just making sure that people are able to, like, if they've been in a car accident, if they had a stroke, or, you know, they have like a brain injury or like a spinal injury, we want to make sure that they can be able to recover from these things. So when I was shadowing, a lot of the things that we would do is when they had like these kind of injuries, we want to make sure we know all these bones and how they work, so that we know like how we can push them or what's going to be best for them. We would usually set up stuff where they would be able to walk, and we need to know, how much pressure can they put on their feet or their femur, what's going to be able to, what can they handle when they're moving, or what bones are they going to move if they move their feet, and can they move those bones? And then like in concerns of like if they had a stroke, we want to know like what part of their brain or what part of their skull was injured, if they have like a flap missing, or if they're in a wheelchair, like what part of their vertebrae doesn't work, and what part are they having surgery on soon, or they're getting prepared for surgery. So we can know exactly, because if their vertebrae isn't working, that'll tell us like how much they can move their head, and how much they can move their legs, how much they can move their feet, and even like their cognition and their motor skills are stuff that like we really pay attention to. And so we want to be sure to really know all these bones by heart. That way when we're in sessions or we're showing them stuff, we're not just telling these things on a whim and just hoping that they recover or get better. We want to know, because every bone is connected to, we're all like connected to each other, and so if they do something wrong, that their arm is, or their humerus is injured, is it going to affect their elbow, or is that going to affect their radius and their ulna, which would affect their carpals and their metatarsals, and so on and so forth. So these are just things that we want to really pay attention to when we're preparing patients to go home and get better. And we just want to make sure that we're really keen on everything inside the human body, to make sure that every patient has like the best care possible, so that they're giving their best effort and we're giving our best effort. So I'm trying really hard to remember everything and just make sure I'm as prepared as I can be. So when I deal with patients in the future, I can, trust myself that I'm doing the right thing as well. Thank you.